Hello, and welcome to Triage Cancer's webinar series, Navigating Young Adult Cancer-Related Legal Issues, Employment, Insurance, and Finances. My name is Monica Bryant, and I am the Chief Operating Officer for Triage Cancer. I will also be your speaker for today. I'd also like to introduce you to our guest speaker, Alec Capellian from Teen Cancer America. And later on today, Alec is going to share with you some of Teen Cancer America's fantastic resources. So if you have questions for either me or Alec or I, you can feel free to type them in the Q&A box and we will get to them as we go. So when I talk about cancer rights law, sometimes people are confused and ask, what is legal about cancer? And the reality is that cancer rights law includes a number of separate areas of law, including employment, insurance, government benefits, consumer rights, estate planning. And some of the topics that we talk about at Triage Cancer aren't usually thought of as legal issues by most people, such as health insurance. But getting health insurance coverage and the consumer protections to use the coverage, to appeal denials of coverage, all of those things are rooted in the law. Now, lack of awareness in the law is sometimes going to be a barrier to people accessing the care they need. And if people aren't accessing the care that they need or don't understand their employment rights, all of those things could contribute to the financial impact of a cancer diagnosis. There has been a term used in the cancer community to describe that financial impact called financial toxicity. And financial toxicity really just describes that financial burden or impact that a cancer diagnosis can have. It's something that was coined in 2013, but it is certainly not a new problem. We've been talking about it for decades. And one of the reasons why it's so hard to address financial toxicity is that there are multiple contributing factors. And if all, or at least most of those contributing factors aren't addressed, there's no way that people can avoid the financial toxicity. And the number one most significant factor of financial toxicity is someone's health insurance status. Now, that could mean they don't have health insurance at all, but more often what it means is they don't have adequate coverage for them, or they're not effectively navigating the policy that they have. So we're going to talk about how to choose the right health insurance policy today. Now, certainly the employment changes that can occur after a cancer diagnosis can certainly contribute to the financial toxicity, and I think this is particularly true for individuals in the YA cancer community. And then the life changes that occur that would normally impact our finances, like relationship changes or moving or graduating from school. All of those things continue to happen after your cancer diagnosis and just compound the financial impact that you may experience. So today we're going to touch on each one of these and point you to places where you can find more detailed information. Now, we know that health insurance is the primary contributing factor to financial toxicity. So in theory, that should be a pretty easy problem to solve. But the challenge is health insurance is so complicated, most Americans simply don't understand how it works or how to choose a plan. A recent study of 2,000 respondents that were asked to describe their understanding of the US healthcare system, 56% of them said that they were completely lost when it comes to understanding health insurance. They were given a quiz to assess their knowledge, and the average grade on this quiz was the equivalent to what someone would get as a D in school. So we're grading at a D with our knowledge to the US healthcare system. And if that weren't bad enough, when you look at the data broken down by age, individuals 18 to 39 were the most likely to assume that they did well on the quiz, that they knew so much about the healthcare system, but they actually performed the worst of all age groups. So it's completely understandable as to why this happens. We often say at Triage Cancer, there should be a class in high school on health insurance and basic finances, because we all need to be able to navigate these things, but we're rarely ever taught. And many people receive their health insurance through their parents for a good portion of their young adult lives. And when they age out of their parents' policies, it can feel like you're being thrown to the wolves with respect to getting coverage. So if you feel like you don't understand health insurance, the message here is you are not alone. We will hopefully deal with some of those issues today, and I'll point you to places where you can get more. One of the reasons why people don't understand health insurance is that there are all these new words that are used in a health insurance policy. And if we don't understand the words, we can't possibly be savvy consumers of health insurance. So to make sure we're all starting off on the same page, every month you have to pay your premium. And this is a fixed dollar amount that you have to pay just to have health insurance. So even if you don't go to the doctor, you're still going to pay that monthly premium. But then when you go to the doctor and actually use your health insurance, there are some other costs that you have to pay in addition to that monthly premium. And the first is your annual deductible. This is a fixed dollar amount that you're going to pay each year. And you have to pay this amount before your health insurance kicks in. Now, the amount of the deductible is going to depend on the policy. So you could have a $500 deductible, you could have a $5,000 deductible. But again, it's the amount that you have to pay before the insurance kicks in. When the insurance kicks in, they're going to pay their cost share or their co-insurance. This is a percentage, and you're going to pay it each time you get care. So for example, if you have a policy that has an 80-20 cost share, once you've paid your deductible out of pocket, your insurance picks up 80% and you're responsible for 20%. And on top of that, you could have a policy that has co-payments. Co-payments are, again, fixed dollar amounts that are going to depend on the policy. They could also depend on the service. So for example, you could have a policy with a $20 copayment to see your primary care physician, and a $30 copayment to see a specialist, and a $250 copayment if you end up in the ER. Now, one of the most valuable things to understand about your health insurance is the out-of-pocket maximum. The out-of-pocket maximum is a fixed dollar amount. And when you paid that amount out of pocket, the insurance company kicks in at 100%. And the way that you get to that math problem, the way that you get to your out-of-pocket maximum is a math problem. So for many plans, the way you would do it is you'd add up everything you pay towards your deductible, everything you pay towards your co-payments, and everything you pay in co-insurance until you reach the out-of-pocket maximum. So it's everything you're paying out of pocket except that monthly premium. And the reason it's so important to understand your out-of-pocket maximum is because it allows us to plan for a worst case scenario. So here's an example of how this works. So meet Dan. Dan has a policy with a $2,000 deductible. It's an 80-20 co-insurance, and he has an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor yet all year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan actually have to pay? The first thing Dan has to pay is his deductible. That's $2,000. So you pay the $2,000, leaves $100,000 left of the bill. Now he's met his deductible, so his co-insurance kicks in. The insurance company is going to pay 80%, and he's responsible for 20%. 20% of $100,000 is $20,000. But does he have to pay that full $20,000? The answer is no. And the reason it's no is because of that out-of-pocket maximum. Since it's an $8,000 out-of-pocket maximum, he's already paid $2,000 in his deductible. He has to pay another $6,000 to reach the out-of-pocket maximum. and then the insurance kicks in at 100%. So we are by no means saying that $8,000 isn't a lot of money. Of course it is. But the point here is understanding the out-of-pocket maximum allows us to plan for that worst case scenario, because $8,000 is certainly better than having to pay $20,000. And it's absolutely better than having to pay the full $102,000. If you would like to hear any of that again with respect to the terms that I just went over or this example, that's included in our animated video on health insurance basics. Now, regardless of where you get your insurance, there are going to be certain times of year that you get to make changes. This time period is typically referred to as open enrollment. So if you have insurance through an employer, and that could be your employer, or it could be your parents' employer if you're on your parents' plan, or maybe your spouse's employer if you're on your spouse's plan, those employers are allowed to choose their open enrollment period. So it can actually be any time of year, but many employers will pick a fall open enrollment to coincide with the start of the calendar year. Medicaid, which is the program for individuals with lower incomes and in some states asset levels, those applications are accepted year round. So as soon as someone becomes eligible, they can apply and their coverage will begin. Medicare, which is the insurance coverage for individuals who are over the age of 65 or who are under 65 but have been receiving Social Security Disability Insurance, SSDI, for 2 or more years. Medicare has that annual open enrollment period between October 15th and December 7th every year. Now, marketplace plans are plans that are sold by private insurance companies, but are sold through the marketplaces that the Affordable Care Act created, otherwise known as Obamacare. And marketplace open enrollment is between November 1st and January 15th in most states. There are a handful of states who run their own marketplaces, and they have slightly different open enrollment periods. So we do have that information on our charts of state laws under health insurance. Medicare and marketplace plans are calendar year plans, which means even if someone picks up a plan on the first day of open enrollment, that plan won't kick in until January 1st at the earliest. So it is important to make sure that people maintain coverage through the end of the year. But the good news is all of these types of insurance recognize that things don't just change during open enrollment. So if someone experiences a loss in coverage or a life-changing event, so a loss in coverage could be, for example, leaving your job, that is going to trigger a special enrollment period. A life-changing event could mean moving to a new state. It could also potentially mean moving to, it could also mean, sorry, we're having a technical issue at the moment. Sorry about that. A life-changing event could also be aging out of your parents' policy. That would trigger a special enrollment period to allow you to pick a new plan. If someone is in a position where they're losing their employer-sponsored coverage, and again, this could be losing their coverage under their parents, losing coverage under a spouse, so maybe if someone's getting a divorce, or it could mean losing coverage through their own employer, and they're eligible for a special enrollment period because of that loss of coverage, they actually have more options for what to do now than they ever have before. So the first option could be electing COBRA or state COBRA. And by doing so, you're allowed to keep the exact same health insurance policy that you had through the employer. The major change when someone elects COBRA or state COBRA is that now, instead of the employer contributing to the premiums, the employee has to pay 100% of the premiums, but it's the exact same coverage. So that could be a major factor. Option 2 could be picking up a new plan through the state health insurance marketplace special enrollment period. And this new plan starts everything over at 0. So you have to pay into your deductible and start paying into your out-of-pocket maximum again. Option 3, maybe there's another group plan that you could go on. So for some young adults, they may have to stop working due to their treatment, but they're under the age of 26. So they've lost their own employer-sponsored coverage, but they're able to join their parents' employer-sponsored coverage. It could also be that someone could be eligible for coverage through their school or an association that they belong to. And then finally, based on circumstances, they may be eligible for Medicare or Medicaid at this point. So really, this is quite a few options for people, and it can feel a little overwhelming on how to figure out, well, what lane do I drive in? It's also overwhelming because the trick with all of this is you have to pick a lane and stay in it. You don't get to change lanes until the next open enrollment period. And where this often happens is people will, they're leaving their job, they're overwhelmed, they get handed COBRA paperwork and they say, okay, I'm going to elect COBRA. And then they get a few months into it and they realize, wow, this is really expensive. Can't I just go and buy a new plan on the marketplace? And the answer is unfortunately no. You have to wait until the next open enrollment. So given that we have all of these options and we have to make the right choice the first time, how do we go about comparing those options? I'm going to give you an example using plans from the marketplace, but the exact same analysis or exercise can be used if you're trying to compare two marketplace plans, if you're trying to compare between two plans offered by your employer, if you're trying to compare a marketplace plan with something your employer offers, or if you're trying to compare two Medicare Advantage plans. It's going to be the exact same analysis. So here we have 3 options. We have a bronze plan that is $200 a month with an $8,000 out-of-pocket maximum. We have a silver plan with a $275 a month premium, a $2,500 deductible, and a $6,000 out-of-pocket maximum. And we have a platinum plan with a $400 a month premium, a $0 deductible, and a $2,000 out-of-pocket maximum. So if I'm in a situation where I'm trying to figure out which plan is going to cost me the least at the end of the year, assuming I'm going to hit my out-of-pocket maximum, which is a relatively safe assumption when we're talking about cancer care. It's also a good assumption if someone is trying to figure out what would I have to pay in total in a worst case scenario. We can't tell just by looking at these numbers in this way. We actually have to do the math. And the way that you do the math for most plans is you're going to take that monthly premium and multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you're going to add the out-of-pocket maximum. And when you do that for all 3 plans, we can see that that platinum plan with the $400 a month premium ends up being significantly cheaper than the other 2 options. And why this exercise is so useful is that many of us just look at that monthly premium and we get sticker shock. And we think, why would I pay $400 a month when I could pay $200 a month? And we don't look at the totality of the situation to figure out, well, what could I potentially have to pay for out of pocket entirely? Now, I will fully admit that this is only a piece of the puzzle, and it's not going to be the right puzzle for everybody. So if I'm talking with someone who's, 18, super healthy, never goes to the doctor except for an annual checkup, maybe that bronze plan is totally sufficient because they're not anticipating that they're going to meet their out-of-pocket maximum. That being said, we spend a lot of time talking to people in the cancer community and even young adults who have been diagnosed with cancer. And so we, and this may be the lawyer in me, likes to plan for a worst case scenario. And the way to do that is by looking at this math. But it's, again, only a piece of the picture. We also want to make sure we're looking at the deductibles, because sometimes plans may end up being a little bit more expensive by the end of the year, but have a much lower deductible. And so for many of us, it is easier to pay a little bit more each month in higher premiums than to come up with a big lump sum in a deductible. So there are some other things to think about. The other thing is that out-of-pocket maximums typically only look at payments made towards in-network providers. So picking the quote unquote cheapest plan that doesn't cover any of your providers isn't going to be an adequate plan for you. So once you've narrowed it down based on cost, making sure any providers, facilities, imaging centers that you go to are in that plan's network. Similarly, looking at that plan's drug coverage. So there is a list of prescription drugs that insurance plans cover. That's called the formulary. And so making sure that any prescription drugs that you are currently taking are in that plan's formulary. And then potentially even talking to your providers about, are there other prescription drugs you might anticipate me starting next year? And then if the case is yes, you can look to make sure that those anticipated prescription drugs are also included in the drugs formulary. Now, I realize that was an incredibly quick overview, but we do have lots of resources on health insurance on our Health Insurance Resources Hub. Two in particular I want to point out to you are our animated video on picking a plan, and a newer resource, our health insurance comparison worksheet. So this worksheet, that's what you can see on the right here, walks you through how to do that math. You can print it out and actually even write in it, and it gives you the math equations to use. It's personally one of my favorite resources because I think it's so useful to anybody, whether they have a cancer diagnosis or not. Now, switching gears from health insurance, I want to talk about the second most significant contributing factor to financial toxicity, and that's the employment changes. When looking to see what somebody's employment rights are, there are a couple of places we might look. There are fair employment laws, which deal with discrimination and access to a tool called reasonable accommodations. These fair employment laws exist at the federal level and at the state level. There are also leave laws that give people the opportunity to take time off from work and protect their job. The federal leave law is the Family and Medical Leave Act, or FMLA, but then there are also many states that have state leave laws. Now, if the employee is working under an employment or a union contract, we're also going to want to look to that contract or collective bargaining agreement to see if there are additional or different rights and benefits that they might have. But remember that, excuse me, the law is just the bare minimum of what employers have to provide. And many employers are much more generous than that bare minimum. So looking to your specific employer's policies can be very valuable. And these can often be found in an employee manual or handbook or policy and procedures document. Every job does it a little bit differently. But if you don't have like a tangible document or a portal that you can log into, certainly you can talk with perhaps your human resources representative if you have one, or whomever at your job deals with things like benefits or you turn your timesheet into. That's a good starting point to find out some of this information. And the policies that could be helpful to look at are things like health, dental, and vision insurance. Do you have access to a disability insurance policy through an employer? Do you have access to a life insurance policy through an employer? I cannot tell you the number of people I have spoken to where I've asked about disability insurance and they've said, no, I don't have that. I never bought that. And then I say, well, go back and see if it's something that's offered through your employer. And they come back and say, yes, it is. It's an added benefit I signed up for and just kind of forgot about. You may also want to look to see what other benefits the employer has set up. So do they provide access to sick time or vacation time? There could potentially be an employee assistance program or financial counseling programs. Many employers have these things, but employees often don't either know about them or don't know why they might tap into them. And so starting by looking at what's available in your job or workplace and asking questions is a really great place to start. We have a checklist to making the most of your benefits during open enrollment. And we have one for employees who are in the job search process trying to figure out what benefits might be useful to them. Now, jumping into the specifics of the laws that we're going to talk about, one of the most important laws in the context of work and cancer is the Americans with Disabilities Act, or the ADA. Many people are very familiar with the ADA because of ramps into buildings or parking spots close to the front of stores. But the ADA did some incredibly important things in the context of work, and that's all housed in Title I of the ADA. And the federal government, or the federal agency that enforces Title I, is the Equal Employment Opportunity Commission, or the EEOC. The reason it's helpful to know what agency enforces a particular part of law is because that's also the agency you might look to get more guidance about how a law would apply, or to see regulations about how the law is being enforced, or potentially to file a complaint if you think your rights have been violated. Now, there are some hurdles that you have to clear in order to use the ADA's protections. So you have to work for a private employer with 15 or more employees, or a state or local government. If you're a federal employee, you have similar rights, but they are under a different law. You also have to be a qualified individual, which essentially boils down to you're qualified for the job in question. And then you have to have a disability under the ADA's definition. Now, I will tell you, many people in the cancer community struggle with this law and the word disability. And I certainly understand where they're coming from. You know, the sentiment is generally, I have an illness or a disease, I don't have a disability. And normally I am one to say words absolutely matter, and we should be very careful in how we're using words. This is one instance where I urge people to not get caught up in the word. Congress needed a word to use in this law in the 90s. This is what we came up with. But to not ignore the protections and the tools that the ADA can provide to individuals in the cancer community because of this word. Now, generally speaking, the ADA does provide protections to individuals with a disability, so the person who has been diagnosed with cancer, for example, and to caregivers against discrimination, which means that really employers can't be making employment-related decisions based on medical information. But in addition to that protection from discrimination, the ADA provides individuals who have been diagnosed or who have the disability with a tool called reasonable accommodations. Now, reasonable accommodations are any change in the work environment or in the way that things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Super clear, right? I know. The easiest way to talk about reasonable accommodations is through some examples, and those examples can be put into categories. The first category is about physical workspace. So this could be like if you're dealing with severe nausea and your office is next to the cafeteria and the food smells make it challenging to work, can you move to an office further away? Maybe it's about special equipment or furniture. It could be about telecommuting. So if you have the type of job that can be done from home, on a computer, does that help solve a situation? It could also be working from a different location. And so I've had a number of people get reasonable accommodations to work from an infusion suite, for example, or to move to a different branch of a office that's closer to where they're receiving treatment. So the first category is about space. The second category is about schedule. And this could be any changes in schedule. It could be about taking additional breaks. Maybe it's shifting schedule. So it's you work in a situation where there's shifts and you're dealing with severe fatigue at night and you work the night shift. Maybe you can shift to the morning shift. The last category is everything else. So it could be about using technology. So if someone is dealing with neuropathy in their hands and they have to type all day, could speak to type software be useful? It could also be a change in policy. And this is a common reasonable accommodation. This could be a lot of different things. So we've heard situations where someone has been told by the employer, it's our policy that everybody work in the physical building. Okay, well, the reasonable accommodation then is a change in that policy so that I can work from the infusion suite. It could also be as simple as something like we have a policy of a specific dress code, and that dress code says no hats, but you're dealing with temperature sensitivity because of your treatment. Maybe you lost your hair and you really need to wear like a winter beanie. You could ask for an accommodation of a change in that policy just for you. And that's what's so helpful about the change in policy accommodation is you're not actually asking the employer to change their policy for everybody. It's just for the eligible individual who has the disability. Another type of accommodation could be a shift in job responsibilities. So, for example, a school teacher who, in addition to teaching children, is asked to do things like monitor recess duty and the drop-off line in the morning, but is dealing with severe fatigue. Well, maybe they can shift recess and drop-off to another teacher or another staff member so that they can really just focus on teaching the children and rest during those other periods of the day. And then finally, it could also be about a change in job entirely. Now, I will tell you, the thing about accommodations is that it can sometimes feel like you're asking for a favor from the employer. But employers that are bound by the ADA are required to provide eligible individuals with accommodations, unless it's an undue hardship or a direct threat, which are very high bars for the employer to have to meet. But they do have to be reasonable. And that reasonable standard can be tricky because it's really going to be very specific to the type of job, the role, the side effects, for example, someone is experiencing. So it may be that it takes a little while and a little back and forth and negotiation with the employer to figure out what would be the most appropriate reasonable accommodation. Now, I mentioned that only the individual with the disability is entitled to reasonable accommodations. So caregivers are not legally entitled to them. But many times it falls into the it can't hurt to ask category. So if you're a caregiver listening and you're thinking, gee, some of those things would be really helpful for me to continue working and being a great employee, but be able to also do my caregiving duties, approaching the employer with accommodation like requests could be useful. Now, I have to tell you, accommodations are one of the most valuable tools. They're also one of the most underutilized tools. So we have a number of resources to help people access reasonable accommodations. And I do just want to mention, while we're talking about, employment at the moment, similar protections exist in the education arena, and we do have a full module on education on cancerfinances.org, as well as in the housing context. And we also just released a new module on housing. So if someone is trying to navigate their rights in education or housing, I highly recommend taking a look at those two resources. Now, I also just want to mention that for employees who need to take time off, whether it's for their own serious medical condition or to act as a caregiver, the FMLA could be useful. Now, unfortunately, the FMLA only applies to employees dealing with their own medical condition or who are acting as a caregiver to a seriously ill child, parent, or spouse. So it's a very narrow definition of family. So you can't take care of a sibling or an aunt or a parent-in-law. And so I think that's a big misconception about the FMLA. Now, the FMLA applies to employees that work for an employer with 50 or more employees and who have worked for that employer for a year or longer. And after they worked for a year or longer and worked at least 1,250 hours, they're entitled to up to 12 weeks of leave per year. Now, the value of the FMLA is that that leave is job protected and health insurance protected. So while it is unpaid, and sometimes people think like, well, why do I want unpaid leave? That's not helpful. The reason it's helpful is it's because it's going to make sure that you have a job to return to. And if the employer pays any portion of your health insurance, they have to continue paying that while you're on FMLA leave. There is a lot of confusion about this. People will say, I'm out on disability. And that alone, short-term disability, long-term disability, sick leave, those things are not going to protect your job. Those things are going to provide you money. It's the FMLA that protects your job. And so sometimes it's helpful, excuse me, to use some of these benefits together. So using short-term disability along with FMLA means not only is your job protected, but you're also going to get paid a portion of your salary. Now, of course, we have a number of resources that go into more detail about the FMLA, how to ask for it and how to use it. But there are also a lot of people that aren't eligible for the FMLA because either they work for a smaller employer or they haven't worked for that employer long enough, or they've used up their 12 weeks of leave. And in those situations, we might look to see if there was a state, county, or city leave law that they could potentially tap into. And if you're interested in what's available to you at your local level, I would point you to our charts of state laws on taking time off. Now, if you have been diagnosed with cancer, there's a likelihood that there's going to be some point when you have to stop working, either for a little bit of time or a long period of time. So what do you do about income in that situation? Disability insurance is an insurance policy that is designed to help make up for some of that lost income. Generally speaking, they're going to cover, depending on the policy, somewhere between 45 to 90% of what you made while you were working. And these insurance policies can help pay for any expenses. They don't have to be medically related. There are a number of places where you can get disability insurance. So you could have a private policy, either that you've purchased, or remember I said that it's something that many employers will give employees as a benefit. There are a handful of state disability insurance options as well. We have a quick guide to these programs if you live in one of these states. And finally, there are two federal disability insurance programs. Both are administered by the Social Security Administration, and they have different requirements to accessing and different benefits. So supplemental security income, or SSI, is for individuals who have low incomes and low assets level. There is a monthly maximum that anyone can get, and typically the benefits are going to start right away. Generally, if someone is eligible for SSI, they're also going to be eligible for Medicaid in their state. Now, the other program is Social Security Disability Insurance, or SSDI. And this program is about having worked and during your working years paying into the system. What you get from SSDI is going to be based on how much you pay in. So Bill Gates is going to get more on SSDI than I would. SSDI does not start right away. There is a 5-month waiting period. Now, once someone has been collecting SSDI payments for 24 months, they then become eligible for Medicare. Of course, that was an incredibly quick overview of the two programs, but if you go to our hub on disability insurance, we have a quick guide that specifically talks about the difference between these various programs. Now, the last thing I want to mention before I turn it over to Alec is about caregiving. If you are listening and you are a caregiver to a young adult who's been diagnosed with cancer, and your caregiving responsibilities have kept you from working at all or working to what you were at prior to the diagnosis, there are some options to receive income for caregivers. They're few and far between, in my opinion, and I certainly think that there is a lot of room for improvement and advocacy with respect to paid family leave in this country. But we do have a quick guide on paid family leave that talks about the different programs in these different states. There is also a program run through the Medicaid program called In-Home Support Services, but it's called something different in every state, so it may not be called that in your state. But if the individual with cancer is eligible for Medicaid, they may be able to get some funding to pay family members to act as a caregiver. So with that, I would like to turn it over to Alec to talk a little bit about Teen Cancer America and the phenomenal programs and services that they provide.
Thank you so much. As she said, my name is Alec Capellian. I'm with Teen Cancer America. I'm also a young adult cancer survivor myself. So at TCA, we work directly with hospitals to set up programs and facilities and help build out what it looks like to provide and receive adolescent and young adult cancer care. And that age range varies a little bit from hospital to hospital, but sits in the 15 to 39 spread generally. So if you are a healthcare provider interested in helping set up a program to bring all the facets of AYA care together, please feel free to reach out to me. I can put my email in the chat. And otherwise, or I'll have them send it out afterwards. And if you're a cancer survivor yourself, please feel free to reach out to me as well. We have a couple different ways that you can get involved. We have a music program where you write and produce professionally mastered songs and join a community of other AYA cancer musicians. From start to finish, you write and produce that song, and we have a professional producer who helps mix and master it with you. And we have an advisory panel board. So in order to make these programs the best that we can be in hospitals, we need the feedback of other cancer patients, because I only have my own experience and we like to get as many perspectives as possible. So please reach out if you want to kind of help further the national picture of cancer care in this country. We currently have 44 hospital partners and over 70 others in consultation. We have a pretty robust strategy process to help think about and build these programs between pediatric and medical oncology. And at the end of that process, if you finish your strategy, you are eligible to apply to a grant where we provide seed funding to help either build out a space or hire personnel, help fund and jumpstart your program. If you have any questions about that, please don't hesitate to ask, to reach out, and we can always give you more information in an email or a short call as well. Thank you so much.
Thanks, Alec. I really do encourage you, if you haven't checked out Teen Cancer America's programs, to just take a look at it. And we will certainly include a link to their programs and Alec's email address if you would like that in the follow-up email. So you all will have that. So I want to just address a couple of questions quickly before we wrap up for the day. So there's a question about, I'm confused by deductibles because I've always had an HMO. Are they generally for hospital care, or are they also outpatient and preventative care? So any policy can have a deductible, even an HMO. In fact, many do. And they're for most types of care. The one exception is certain policies that are subject to the Affordable Care Act have to provide certain preventative services for free. And so that's going to be things like immunizations, certain cancer screenings. And so those things that are on a specific list, you'll be able to receive for free, and they won't be applied to your deductible. But other than that, the deductible can be for any types of services. There is another question about, what's the best option for public health insurance? And I think what they're referring to is individual health insurance. So something you would go out and buy yourself that has a reasonable out-of-pocket maximum and will cover most cancer treatments, scans, appointments. I would highly recommend that you take a look at the health insurance marketplace in your state. So the reason I say that is because plans sold through the marketplace are sold by private insurance companies, and they have to comply with all of the consumer protections in the Affordable Care Act. So in addition to knowing that you're buying a quality policy, there could also be financial assistance for you to purchase that policy through the marketplace, depending on your household size and income level. So if you haven't taken a look at the marketplace in your state, I highly recommend that. Everyone can start at healthcare.gov. And then if you live in a state that runs their own marketplace, you'll get kicked over to that marketplace. So in the interest of time and being respectful of your time, I just want to wrap up a little bit. If we weren't able to get to your question, I encourage you to reach out to us through the Legal and Financial Navigation Program. I've put up the links that you can use to access that program here again. We also hope that you will join us for events in the future and connect on social media, and certainly keep an eye out on our blog. As a reminder, if you're a healthcare professional on today and you'd like your continuing education, be on the lookout for an email tomorrow with the evaluation post-test link. You have to complete that within 1 week. And if you're a nurse or a social worker, you do have to get a passing grade. There is an opportunity for one retake. So if you take the test and you see a screen like this, you have nothing left to do. We'll send out your certificate within 4 weeks. If, however, you see a screen like this, you'll need to go to triagecancer.org post-test and scroll down to find this webinar. Click on the link, and then you'll have an opportunity to take the test one more time. Even if you're not a healthcare professional, we do hope that you'll take some time to provide feedback about what you thought about today's program, so that in the future we can make it even better. So again, I'm going to just say thank you so much for joining us today. Thank you, Alec, for being here to talk about Teen Cancer America and helping us spread the word. We are stronger together, and so appreciate our partnerships. And I hope you have a wonderful rest of your day. Take care, everybody.